Right? Hello, everyone. I'm Shruti Trivedi, and I am a pregnancy loss coach. And today I'm joined by Dr. Fady Sharara, who is a fertility expert in Reston, Virginia. He's also a professor in GW, and I'm super excited to have this conversation with you. So, without further ado, Dr. Sharara, can you talk about how common miscarriages are?
So thank you, Shruti, for having me. And miscarriages are incredibly common. Um, People don't know how common they are until they have a loss and they start asking their friends, and all of a sudden they see how many people have gone through this. So the incidence of miscarriages increase exponentially with age. So even in young women, less than 35, about 15% of pregnancies end up with a miscarriage. By the time you're 40, that's about 25 to 30%. By the time you're 42, 43, you're looking at 40% or higher. By the time you're 44, 45, the vast majority of these are miscarriages. Now, why do people miscarry? They miscarry for multiple reasons. The most common is what's called genetic anomalies. So as women age, the chance of having chromosomal abnormalities or the embryo being genetically not normal increase exponentially with age, especially after age 35. Okay, so if you test an embryo by age 35, about 50% will be normal, 50% will be abnormal. By the time you're 40, 2 out of 3 will be abnormal. And by the time you're 43, literally 90-95% of them will be genetically not normal. So it's nature's way of getting rid of what's not normal. Um, Before, the definition of what's called recurrent pregnancy loss, okay, was 3 miscarriages before your OBGYN say, okay, maybe now you need to go to a fertility specialist to do a workup. That definition changed a few years back from 3 losses to 2 losses. And however, many OBGYNs are not aware that this has changed, and they tell you, okay, if you're 22, 25, and you have a couple of miscarriages, they tell you, no, no, it's fine, just keep going. But there are multiple causes of miscarriages, okay? There's genetic anomalies, and there are other things. So the genetic anomalies is what I just mentioned, which is basically increasing genetic anomalies as women age, okay? But there are other causes. So anatomical, for example, if you're born with a uterus that is half a uterus, what's called a unicornuate, or you have what's called a uterine septum, or what's called a bicornuate uterus, which is a heart-shaped uterus, those obviously carry a significantly higher chance of miscarriages. Okay, if your thyroid, for example, is abnormal, that increases the chance. If your prolactin, the milk hormone, is elevated, that increases miscarriages. If you have diabetes, okay, that increases the chance of miscarriages. So we want to rule out all these things. Sometimes you're born with what's called a balanced translocation, meaning there's 23 chromosomes, 1, 2, 3, 4, 5, up to 23, and then there's the XX in women and XY in men. The balanced translocation is part of one chromosome moving from, let's say, chromosome 6 to chromosome 11 and 11 onto this. Usually the most common ones can include chromosomes 13, 21, 18. So if there's a balanced translocation, there's a higher chance. In some people, they may have what's called an unbalanced translocation. So this is another genetic reason. So we do what's called a karyotype. So we draw your blood. It takes about a month to get the result back. Women are supposed to be 46XX. If there is something else, a balanced translocation, then we see that, and that can cause recurrent miscarriages. If you have an antibody, so something like anticardiolipin antibody or lupus anticoagulant or something called factor 5 or beta 2 glycoprotein, so there are other things that can cause you to lose a perfectly genetically normal baby. And we do a blood test called thrombophilia profile that checks for all these things. And if you have something positive, then as soon as you're pregnant, you need to go on blood thinners, something like Lovenox. So these are some of the main reasons why people miscarry. But we urge the OBGYNs, if God forbids you have a loss, we tell the OBGYN, if you're going to do a DNC on that person, please send tissue to be analyzed and find out, was this pregnancy normal or abnormal? If it was abnormal, then at least you would feel a little bit better that nature got rid of what's not normal. But then if you got another one that's abnormal, then you absolutely need to start the investigation. Why are you having this? Are you having this because you're 40 years old and the chance of a miscarriage is much higher? At which point you may need to do other things to make sure you don't keep having miscarriages. But if you lose one and it ends up being genetically normal, then we should look for reasons why you lost a genetically normal pregnancy. Early on, when people get a pregnancy test, we highly recommend that they do the beta ECG, which is the pregnancy titer, and check their progesterone level. In some cases, the progesterone level may be a bit lower, and we may be able to save a genetically normal pregnancy by adding progesterone. You're not going to be able to save a genetically abnormal pregnancy, no matter how much progesterone people take. If it's abnormal, it's going to be lost, or worse, if it's a Down syndrome, 90% get lost, 10% stay, and then you find out at 11, 12, 13 weeks when you do the NIPT, at which time it's a huge decision about what you want to do with this pregnancy.
Right. That was a wealth of information. I think I have to probably go back to rewatch this, but it was so informational. And I know I learned last year that 1 in 4 pregnancies actually experience a loss. And to be honest, I didn't know. I honestly thought it would be 1 in a million, because when I had my losses, it was always the question of why me. Like, that question always haunted me for the longest time, and it just feels so exhausting, and you just feel alone. But when I started talking about it with my friends, I actually got to know that the friends that I knew for 15, 20 years had experienced a loss, but we never talked about it, because we are supposed to not talk about it and shove it in. My grandmother had experienced 5 losses, and we spoke about it back in 2017 after I lost my twins, and I was shocked. And she was like, yeah, it happened, and everybody was experiencing loss back in the 50s. Sure. And so we just never talked about the losses. It was so casual, and that's where it became a life mission for me, that I'm going to openly talk about it and raise this awareness for women, that the loss is a loss, and every loss needs to be respected, because that was a human. I think that is something I've realized over time, that pregnancy loss is sometimes casually dismissed as like not a loss, like only a few weeks. But I truly believe that life begins on the first second of conception, and when we come to know on the positive test that we take. But that's just been a journey for me to raise that awareness.
So your story is not unique, and this is where men and women see things a little bit differently. A miscarriage is an absolutely traumatic event for women. Okay, a lot feel exactly like you. What did I do? They blame yourself for the loss. It has nothing to do with you. Okay, so what you need is actually somebody who's qualified to tell you why people miscarry. Okay, you should not accept them as a fact of life, because whenever you have a miscarriage, most women feel that they lost a pregnancy, which is exactly what it is, but they feel they lost something, okay? And many OB/GYNs are very dismissive. It's okay, you can go and try again, which is probably what you were told.
Yeah.
But you need to grieve this, okay? That's number 1. Number 2, you need to find out why. The problem with a lot of patients that I see is many of them do not act on this. Neither do their OB/GYNs. Okay, many of them say, just go try again. Even if you're 40 years old, instead of telling you, look, maybe you should go and see a specialist and discuss this with him, because you don't want to go through this. And it's so traumatic. We don't want people to go through another miscarriage. We want people to have a healthy baby afterwards. Time will heal, but that loss never goes away. So you just need to be proactive. The biggest problem that I see is most people are not proactive. They accept, like your grandmother told you, it is fact of life. I had 5 miscarriages, so this is not normal. Okay, Miscarriages are not normal. I don't want people to normalize miscarriages, okay? Because they happen for a reason. If everything is fine, a miscarriage is not supposed to happen. So we need to know, why are people miscarrying? And if you don't do the right workup, then this may happen over and over. And we have some patients who have gone through 2 or 3 miscarriages, and this event is so traumatic, they don't seek care at all afterwards. They say, you know what, this is what maybe God has meant for me. This is not true. This is science. We're in 2026, okay? We have enough scientific advances to really deal with this in the vast majority of patients. So I'm so happy you're actually trying to raise awareness, because a lot of women feel like you. They feel this is something they have to suck it up. They don't have to discuss this with anybody else. It's absolutely not true, because this festers in you and it becomes worse with time, and you feel nobody is understanding you, and you feel nobody is being sensitive to you, because you have gone through this, and you feel alone. Like exactly what you said, you're not alone. We're all here to help people like you. You just need to make the initial step and say, you know what, I need to go and discuss this with somebody who deals with this on a daily basis. And this is what we do.
Yeah. No, I'm so happy that you're also creating that space, and you definitely have a very special place in my life. But thank you so much for talking, and for the viewers, if you have any other question, feel free to put it in the comments, and we'll have another session with Dr. Sharara and get them answered. Thank you so much,
Looking
Dr.
forward.
Sharara.